Which of the following conditions is the most likely cause of this patient's presentation? 40-year-old man with history of polycythemia vera presents with sudden onset of right upper quadrant pain, jaundice, and ascites. Physical examination reveals hepatomegaly and mild splenomegaly. Doppler ultrasound shows an occlusion of hepatic veins. Okay. So I think, yeah, let's see. I like portal vein thrombosis here. I like polycythemia vera, sudden onset. Okay, so sudden onset of upper quadrant pain, jaundice, and ascites wasn't over a period of time. They didn't give BMI or anything like that. It might be non-alcoholic fatty liver as well, because it presents similar.
So I want you to, once again, cause and effect, right?
Okay.
That's how I want you to be thinking about these questions because I think right now your train of thought is you're trying to kind of when you're looking at the answers. This is kind of one of the things that I want you to work on is you're looking at the answers and you're asking yourself, okay, which one of these fits with the answer? Like
Right.
which pieces of evidence, right? But really what you should be thinking about is like you have a 40-year-old male with polycythemia vera, then all of a sudden right upper quadrant pain with jaundice and ascites. So polycythemia vera, what is that?
Um, Increase of EPO. So you're gonna have
Well, just yeah, so actually not
or
increase.
high hematocrit, maybe. I'm not
Yeah,
sure. I don't
high
know.
hematocrit is the right
Okay.
word, right? So
Okay.
too many red blood cells, high hematocrit. Okay, so that makes the blood very thick. Okay, then you
Mm-hmm.
have a physical exam that reveals hepatosplenomegaly, right? And then
Mm-hmm.
you have a Doppler that shows occlusion of the hepatic veins. Why did this happen?
Oh, okay. So it's either a thrombosis or a PVC. I mean, especially if it's sudden,
Okay,
that makes more
but you
sense.
yeah, you get what I'm saying. You got to follow the picture because what's
Okay.
happening is you're taking each individual sentence and you're looking at it in isolation, and then you're taking
Okay.
your answer choices and you go, okay, so I have four pieces of evidence, right? This one can go with this one can go with two. That so you're kind of working backwards, right? Instead of following the story, right? The cause and effect of it, that's going to help you take this test, right? And so
Okay.
now kind of what do you think is going on here?
Well, if he has like the polycythemia vera, like you said, it's thicker blood. Is that more likely of like the PBC there, or is that like
Okay.
portal vein thrombosis, like blocking? That's what I'm now not sure about because I'm trying to
Okay.
fit it in still.
So talk to
Um,
me about, okay, so you know it's not acute viral hepatitis, right?
I don't think so.
Okay, you don't it shouldn't be non-alcoholic steatohepatitis.
Not if it's so sudden. No, I don't think
Exactly. Okay,
so.
so now we have these. Okay, so
I don't think
portal
it's
vein.
Bud. I don't think it's Bud Carey. I don't think
What is
so.
Budd-Chiari?
Um, Bud Carey. Why am I thinking of something with? I don't know if I could explain. I don't know if I could define Bud Carey.
Okay, so let's kind of keep that on the board and we'll kind of talk.
Bloated red. Okay, that's what I usually think of that, but I'm not. Hmm. Okay.
Okay, portal vein thrombosis. So where is the hepatic veins in the portal vein?
It's right next to it.
Okay, so it's different, right? They're
It's
different,
different. It's
right?
different.
So it's if it was a portal vein thrombosis, then it would say the portal vein has a clot in it.
Okay.
You understand
Okay.
what I'm saying? So they're two
Yes.
different things. And then what is primary biliary cirrhosis? What is that?
Um, I'm trying to like. I always this one. Primary biliary cirrhosis. I think it's. Is it where you have a blockage in the biliary tree?
So primary biliary cirrhosis is an autoimmune disorder where all
Okay.
your bilious tract starts scarring down, and it's a chronic thing. It can be associated with your inflammatory bowel diseases, but it's not going to be in this acute setting like this, and it's not a
Okay.
clot, right? So
Okay.
the answer should be Budd-Chiari syndrome, but let's talk about
Okay.
Budd-Chiari. Budd-Chiari
Okay.
syndrome is it's a clot in the hepatic vein. That's exactly what it is.
Okay.
Okay. So, Budd-Chiari is a hepatic venous flow obstruction, can be caused by various conditions, but usually hypercoagulable states like polycythemia vera, which increase your chances of having a random clot somewhere, right? Because most
Okay.
people are not getting Budd-Chiari syndrome, right? You shouldn't have random clots that just form where your liver is, right?
Okay.
So polycythemia vera increases that risk. But let's look at the other portal vein thrombosis, right? That's the occlusion of the portal vein,
Like you
right?
said. Okay.
But it's not the hepatic vein, right? It's right next to it, but not the same thing. Primary biliary cirrhosis, autoimmune disorder of the liver, right? Small bile ducts within the liver causing cholecystasis and cirrhosis, right? That's not what's going here. Acute viral hepatitis, right? So hepatitis A, B, C, right? So,
Hmm.
you know, those are either IV drug users, right? Those are,
Or travelers, right? The hepatitis
travelers.
A with
Exactly.
Mexico. Okay.
Exactly.
Blood. Okay.
Non-alcoholic steatohepatitis, usually they're going to give you a high BMI, right?
Hmm. Hmm.
Obesity, insulin resistant, dyslipidemia. But, looking at this, they're not giving you any of that. So that can't be the answer. But does that make sense how I work through it?
Yeah, it makes a lot more sense.
Yeah, you
Yeah.
got to work through kind of the problems like that, because I think what
Okay.
you're doing is you're deconstructing you're taking the question and you're deconstructing it to a point where, if this makes sense in your mind, the sentences aren't talking to each other, they're not related. You're
Correct.
deconstructing so that a 40-year-old man with a history of polycythemia vera presents with sudden onset right upper quadrant pain, jaundice, ascites. Okay, that's one sentence. Okay, physical exam reveals hepatosplenomegaly, mild that's another sentence, right? But in actuality, these questions are written where all these sentences are related in thought process to each other. So you got to see it that way, like that. It's like telling
Okay.
a story, right?
Okay.
The story has a flow to it, right? A beginning, a middle, and end. But if I took one sentence from the beginning, one sentence from the end, one sentence from the middle, it wouldn't make any sense. You get what I'm saying? So you gotta
Yes.
you gotta interpret this as like a story. So
Okay.
that's what I would say to
Okay.
improve on kind of question strategies.